Hello, it's Brooke from Fashion Freedom Fighters, and I'm talking about one of my alignment cue Hall of Shame. It's a pet peeve. It's a pet peeve. So it's pull your shoulders back, which often comes in many names. Draw your heart forward, expose the front of your chest, throat, sternum, and it usually comes with its buddy, pull your shoulders down. So the problem with this is several things. First of all, you've got people who are walking around in the world extremely efforted in their shoulders. Also, who wants to make friends with this creepy person? But also, you're dragging, shoving usually, so if this is me normal, shoving your mid-thoracic spine forward, flattening that out. And that puts an awful lot of strain on all of this musculature, which those of you watching know already has enough problems. So we overuse here, and then when you take your thoracic curve, our natural thoracic curve out of the picture by shoving your mid back up towards your chest, you're just asking for a lot more trouble here. So when people hear me rant about this, they often ask, well, what should I do with my shoulders? Ideally, nothing. Ideally, you don't have to walk through the world forcing yourself to be a certain way. I know we get pulled out of alignment in our soft tissue, and my friend Tiny here is soft tissue challenged, so he doesn't have to deal with the same stuff we do. Our pec minors can pull us forward, so we have to work in our practices towards balance. And if you notice that your shoulders keep getting into a position where you feel like you have to pull them back, pulling them back is not the answer, but looking at what are you doing? You know, you're doing your push-ups with your elbows way out to the side. Are you doing your chaturanga the same way with internal rotation? So you've got to tinker towards balance, but ideally the shoulders just hang there. So that's why I'm hanging out with my friend here. The architecture, the bony architecture of our shoulders is the clavicle into the scapula here. Scapulas are shoulder blade. So it's got this spine here that crawls forward and meets the clavicle. So these are our bony shoulder pads. And they're designed to just, like those tacky, awful suit jackets for women in the 80s, sit there. And if the tissue is balanced, that is going to sit nice and open without you having to retract your scapulas and shove the mid-thoracic spine forward. So if you're having a lot of pain and tension in your upper shoulders and neck, and you're forcing yourself to, sit at your desk shoving the chest forward, see if a week's worth of letting that settle, even if it means you feel like this, I'm not telling you to do this, but if it makes you feel that way, experiment, see if the pain gets better. Rant over. Thank you.